When a heart attack or a stroke occurs, this is caused by the lack of blood flow to the organ. And so, as a consequence, billions of cells will die in the context of these types of injuries. This drug is intended to stop that cell death response from happening in the first place, so that when doctors are able to recover those patients, the organs are able to function more effectively. And despite the fact that researchers have understood how the injuries are occurring, we've never made a breakthrough that has ultimately been able to translate into the clinic where doctors have access to a new drug. And so this is a really exciting new opportunity for us to take a new drug target and a new molecule that we think has that opportunity to break through into clinical practice. The benefit here is that this is a drug that could be given really at the earliest point when a first responder meets a patient who might be having a heart attack or a stroke. Patients who have experienced a heart attack or a stroke are ultimately the #1 leading cause of death in the world. And the reason why this is the case is that doctors don't have any drugs to prevent these injuries from happening in the first place. And so a drug like this has potential to really transform clinical care by preventing these injuries from happening in the first place and really improving the quality of life of patients who have experienced heart attacks and strokes.
So we had a particular drug target in mind that we thought would be useful for stroke, and it's an ion channel. And it turns out that venoms are the richest source of molecules that modulate the activity of these ion channels. And so we went looking in our venom collection, which is the largest in the world. And amazingly, the winning molecule came from the venom of a local spider. The Gari funnelweb spider had an amazing molecule which we were able to purify and show that it was about 50,000-fold more potent than the best small molecule inhibitor of this ion channel. And then once we'd got that molecule, we were able to then test it in a rodent model of stroke and show that it was incredibly effective. Well, the candidate we're developing has the potential to really impact on millions of people per year. So there are about 15 million people that die of stroke and myocardial infarction a year. The number of people that have a heart attack or a stroke is obviously much higher. All of those people could potentially benefit from this drug. So we're talking about a patient population potentially of tens of millions of people per year that could benefit from this drug. There's two major benefits. The first is that there are effectively no drugs that will protect the brain during a stroke. There is one clot-busting drug for stroke, but it can only be given up to 4 hours after stroke onset. Now, we've shown that this drug is effective even at 8 hours after stroke. So those people, for example, that might live in a regional area and take a long time to get to the hospital would benefit even if they got there 8 hours later. But we think it's even better than that. The problem with TPA, the only drug currently available, is it can only be given to people with an ischemic stroke. There is another class of stroke called hemorrhagic stroke for which that drug is contraindicated. The problem is when a paramedic finds a person having a stroke, they don't know which type it is. And therefore they can't give that drug. You have to wait till you get to the hospital, which could take hours if you're in a regional area. You have to image the brain, and then your neurologist has to make a decision as to whether to give that drug or not. The drugs that we're developing should be available for first responders. So as soon as the person's found, regardless of the type of stroke, they can get some protection on board, and we think that will have a real impact on the ultimate severity of the stroke and the quality of life of the patient afterwards. It's not unique to the Gari, it's unique to the Australian funnelweb spiders, of which the Gari spider is one species of about 35 that exist in Australia. The exact molecule that's in the Gari spider is possibly not found in the other funnelwebs, but related molecules would be found in the Australian funnelweb spiders, but only found in Australian funnelweb spiders. So it's a unique Australian molecule, if you like. Yeah, look, I think the Australian investment's been one of the most exciting parts of this, and it started with philanthropy. So we had some wonderful philanthropic donations from the lot, for example, and that really helped bridge us from these basic discoveries into commercialisation. And then, of course, we've raised $23 million purely from Australian investors, and I think that's a real, exciting development, not just for us, but for the Australian biotech ecosystem, that there are people there that are willing to invest in Australian discoveries and keep them on shore.